Welcome to DrBTalks. This is your host, Dr. Luvuyo Bayeni. Today's topic is on contraception, also known as contributing to family medicine and family planning. What is contraception? In most cases, people think that one, it is a responsibility of the females. However, we would like to encourage and change that notion here at DrBTalks, because when it comes to contraception, it's about prevention of falling pregnant, prevention and avoidance of unwanted pregnancies. And of course, as we know, it takes two to tango. Contraception is not only about females, but it is about the couple. It is about the two people that are engaged in sexual activities that may result in pregnancy. And of course, we always link it to what we refer to as family planning, because for us, we do encourage people to fall pregnant. We do encourage people to make families, but only when they have consented, they have discussed, they have agreed, and have planned, hence the name family planning. We do have a lot of types of contraception that we would like to take our viewers through. And one of the most interesting one, which is very theoretical, I must say, is what they refer to as the coitus interruptus, whereby it is allowed that when you are having a sexual intercourse, you may stop and decide not to impregnate each other. However, as my lecturers will always tell us, please don't write that and don't rely on that, because we know human factor, we know human behavior. So virtue, it is the most reliable form of contraception that one can think of. But we do want to share and inform you that it is one of the available contraceptive forms. But of course, let's talk about what is practical and what people can be able to rely on and can be confident in, including discussion as well as practicing it. We've got what we refer to as the barrier methods, where Moy and you will know more about in condoms. And yes, that is an example of a barrier method. And we do encourage people to always use condoms. And we do know that nowadays, it's not only males only that can access condoms. We also have female condoms. So it's amongst the barrier methods that we do encourage people to use. And of course, it has been proven that it is not only about family planning, but it also assists in reducing sexually transmitted infections as well. So it does play a dual role. Hence, we always encourage people to always use it. And also, it does couple as a dual method of contraception as well. That when you even choose other methods that we're going to share with you now, you can still use a barrier method on top of it. We then have what we refer to as a dual method. People will know that what they refer to as pills, where people are expected to use the pill every day. Let's also confirm that this is a format that's used at what we refer to as hormonal, where the control is mainly on adjusting and controlling your hormones. But it's got its own risk and challenges, especially for the society. I'm sure even the viewers now, there are a lot of people that says, no, I've tried that one. I would forget the time to take the pill. I would be out busy, forget to take the pill itself. And unfortunately, when you're using the pill as a method, one of the key requirements of that is that you must be consistent with the time that you are taking the pill. Because remember, the whole point of the pill is to make sure that the hormones that are there in the pill are available in your body throughout the cycle. Once you miss the time, you create what we call as an open loop if you change your times. So it is always important that you stick to the same time. The other issue that is important as well when it comes to using or choosing the option of pills is to ensure that you always alert any other physician or clinician that you are consulting that whenever they prescribe you any medication, they must be aware that you are also using a pill as a contraceptive method, because equally so, there are medications that interact with the contraceptive pills, and that may make or result in your pill not being effective. And I'm sure that there are viewers that say, no wonder I fell pregnant when I was using a pill. It could have been at the time that you were using another medication, which made your pill not to be as efficient and effective as it ought to be. So under hormonal, we also have what we refer to as the injectables. Most of us would have grown up hearing people talk about the DrBTalks. We also have the Nersterate. And yes, those are the injectables that give you space and time. You don't take them every day like we do with the pill. And the Nersterate is every 2 months. The DrBTalks is every 3 months. So there is a convenience that comes with it. especially when you know that you would rather have that one appointment once in 2 months or once in 3 months. And of course, we do encourage people, whenever you choose or you are interested in an option, please consult, make sure that you understand and you have enough time even before you choose, so that you can understand what are the side effects of each. Because in medicine, most, if not all, the medicines that we use have got side effects, and you need to know about all of them before you choose. We have introduced, and some of you might have heard, there was a hype when we were introducing and launching it, what we refer to as the patch. And those are meant to also control the hormones. Very convenient for people. It's at your own time. You keep it for a week, you keep it and you remove it afterwards. But we've also introduced an interesting one under the long-acting contraceptions. These ones, it's what we refer to as your implants. Yes, there was a hype, there was programs, there was even awarenesses that were done by government to encourage people to consider. Because this was introduced now as a contraception that you can use for 3 years. Yes, 3 years of contraception. And we do encourage people to equally understand that this is an option meant to be availed to you at your convenience, because equally so, other people had reported there were side effects that they were experiencing, especially when it comes to the injectables, but they still would not want to take the pill and they wanted something longer. And the introduction of the implants was also a breakthrough in terms of contraception. So we encourage people to consider the different options. Yes, we know that there is also a 5-year long-term contraception. Other people call it the loop. We decide to call it the intrauterine device, contraception device, IUCD. It is supposed to protect you for 5 years. And the advantage with it is that whenever you would like to have a confirmation if it's still in situ, you can consult your nearest healthcare facility and ask them to confirm that it's still in situ. And that is your planning, that you would know that you don't want to fall pregnant within the next 5 years. And of course, we've got what we call the long-term and permanent. Well, this one I want to talk to as well, the male viewers. It is not only for females, because sometimes when we talk of permanent and long-term, we think it's only females that must go for sterilization. We also have an option as males, which is to do vasectomy. Yes, it is available and it's a form of contraception and a family planning form, where as a male you can also go for your vasectomy. It is a long-term and you will be free to plan. However, what we would like to raise with men, that has come up quite frankly and repeatedly so, is to encourage men to be open, transparent and consult and share with their partners. We've heard stories that a male will sit knowing that they've done a vasectomy, and now it creates a problem with the families, because if the unfortunate thing happens that the other partner falls pregnant, it's only the male that knows that they have been undergone in the vasectomy. So encourage males that when you choose this option, it should not only be about you. This is a part of contraception, it's part of family planning, and by virtue we would like to encourage you to be involving your partners. So we're hoping to achieve when we talk about contraception. DrBTalks is here to create an opportunity for you to have conversations with your kids about the type of contraceptions, both boys and girls. DrBTalks is encouraging as well that as partners, let's make sure that we have open conversations about which type of contraception we want to use, because equally so, whichever type that we choose, the partner's support will always be encouraged. Whether it be a pill, it will be lovely for you to tell your sweetheart to say, baby, it's time for your pill. Whether it's an injection, it will also be encouraging to say, let's go for your injectable. And if we go for implants, it's also encouraging to say, don't forget that after 3 years, we'll have to go for the implant check and change for that matter. So encourage that partners must be involved in contraception. The contraceptive debate must be a conversation that takes place between us as partners, between us as families, and as well as the communities. We hope that this has been empowering for you, and you can use it to even empower others that may not be able to watch and view with us now. Please feel free to drop your comments, your questions and inputs on the comment section on DrBTalks, and please make sure that you invite as many people, share the information with as many people, because ours at DrBTalks is to ensure that we reach out, we edutain, and we entertain others. Thank you very much.